long-term care specifically?
Yeah, thanks, Adam. And as you've highlighted, long-term care is not covered in Medicare. So it's a really, really key healthcare decision and one that can have a major impact on someone's financial plan. So in a nutshell, long-term care is going to be for those individuals who are struggling to or can no longer perform everyday activities on their own. I know a lot of people, when they hear long-term care, immediately think of maybe an elderly family member in a nursing home, but truthfully, long-term care is much more broad and could also mean assisted living or even in-home care. Some common triggers that we see for long-term care include Alzheimer's, arthritis, cancer, and strokes, just to name a few. But that's sort of a high-level look at what long-term care is. But now we can take a look at how much it truly costs. So you'll see on this slide here that long-term care comes in all different shapes and sizes. There are different levels of care and other factors that will play a role into the cost of long-term care. For example, costs can vary drastically from state to state, which may even play a role into where you decide to retire. But when considering how to pay for long-term care, there are really three options. Number one, you can self-insure. You can pay for it yourself out of your pocket if you have the adequate savings. Number two, you could pay through long-term care insurance, which we'll kind of dive into more detail in a few slides here. But number three would be crossing your fingers and hoping that a family member may step in and help out. And that actually is a very common scenario that we see where long-term care is provided by an unpaid family member. So with that, it's really important to consider them as part of this conversation, as it may have a pretty substantial impact on their lives as well. And like Medicare, there are a lot of details that go into long-term care, and we could spend, hours and hours all day discussing it. But I think a great starting point is really thinking through what level of care you might need, both from an affordability standpoint, but also thinking through the level of care and who might be providing that care, looping in family members if necessary. So moving on to myth number 3 is long-term care all or nothing. So I highlighted this a little bit earlier that, a common misconception is that people think long-term care equals 24-hour care in a nursing home, but making it really cost prohibitive. But the truth is that you can really tailor it based on your personal situation. As Adam highlighted throughout a lot of this webinar series, a lot of these decisions are really case by case. But with long-term care, you have some flexibility and you can really tailor it to your personal situation. There are a lot of factors that play a role in long-term care costs, such as location, level of care. But the real key takeaway here is that there is a massive spectrum of different price points, and it's definitely not an all or nothing decision. So on this next slide here, you'll see some framework that we'll actually be sending out to all webinar attendees. So you'll be receiving this full checklist. And again, a lot of details that go into long-term care, but hopefully this checklist will help serve as a strong foundation to work off of. Some key points highlighted include, does your financial plan show that you have the assets to cover long-term care through self-insuring? Taking it a step further, will they also protect your legacy if you plan to leave one? Do you have an HSA? Adam highlighted the great benefits of an HSA account and how it could serve as a really nice long-term tool to cover some of these expenses. So again, this checklist is a starting point to start thinking through some of these key questions. And we've touched on it a little bit, but long-term care insurance is a great option for some individuals to combat these long-term care expenses. Typically, we see that the optimal age to consider long-term care insurance is usually before age 60, as premiums begin to rise pretty significantly after age 60. But long-term care insurance can typically cover staying in a nursing home or assisted living facility, adult daycare, or in-home care. Keep in mind that long-term care coverage will not cover medical care costs. So many of your medical costs will fall under your coverage plan through Medicare. But ultimately, when it comes to the decision of whether or not to get long-term care insurance, it really comes down to what level of risk you're comfortable taking and how well a long-term care policy fits into your bigger financial picture. Again, looking at your plan holistically and how the pieces work together is really important and should be looked at on a case-by-case basis. And then finally, with regards to long-term care, we highlighted this a little bit earlier, but again, a lot of these decisions should be family-centered. We encourage you to have those tough conversations, have those tough discussions now ahead of time, to avoid any of your loved ones feeling ill-prepared or blindsided trying to care for you. This also includes regularly updating and revisiting estate documents, for example, more specifically your living will, where you would outline your preferences about future healthcare treatments in case you're ever unable to communicate those wishes. This will relieve family members from this pressure and will also ensure that your wishes will truly be followed.